Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Matthew Toth. He is an orthopedic surgeon with specialized training in sports medicine who studied at the Andrews Institute, and we're going to talk about his practice in Central Georgia. Dr. Toth, thanks so much for being with me.
Thank you for having me.
Would you let our audience know a little bit about the specialized training that you have in sports medicine?
Yeah, so when we do a fellowship, it's an extra year of training after our residency to focus on a specific focus in orthopedics, and my focus was sports medicine. So primarily working with athletes, but sports medicine doesn't mean just working with athletes. It really means working with patients who are not athletes as well. Primarily in terms of sports, we do arthroscopic procedures, so minimally invasive procedures of the shoulder, elbow, hip, knee, and sometimes the ankle. And that's really what all the sports medicine training is about.
Why did you pick sports medicine? If you had picked orthopedic surgery, and then what was your attraction to sports medicine?
So I grew up playing baseball and a couple other sports as well, and I had several injuries myself growing up, and I was under the care of some sports medicine surgeons. Fortunately, I never needed surgery and was able to be treated non-operatively, but that always was something that interested me and piqued my interest in not only orthopedics, but in sports medicine itself too.
When we talk about the mechanics of sports and sports injuries, how important is it for adults and adolescents who are playing sports to understand how to prevent injuries?
Prevention is very important, and that was one of the things that Dr. Andrews during our fellowship training really impressed upon us when we go out and start our own practices. It's often difficult to, and especially nowadays, kids want to play all year round and train all year round. And unfortunately, that can lead to a lot of overuse injuries that we see. And so working from the start to work on proper mechanics, training regimens, starting with them early and working with the trainers at school is really important to help them prevent those injuries so that we don't have problems later on.
Can you tell us about your fellowship training with Dr. Andrews?
Yeah, so I trained at the Andrews Institute in Pensacola, Florida. Again, it was a one-year specialized training in sports medicine, and we had unique opportunities to work with different college sports, high school sports, and also professional athletes, so athletes of all levels during that year, and how to appropriately take care of those patients both from the non-operative side and also the operative side. And so managing them in clinic, but also doing specialized procedures arthroscopically, minimally invasive with a camera and in the joint, and how to do some of those special techniques that Dr. Andrews has made tried and true over time. That was really something that was an excellent experience for me.
And how has that played into your career now as an orthopedic surgeon? Tell us about your involvement with some even local sports, high school.
Yeah, so currently I'm the team physician for John Millage Academy in Milledgeville, and taking care of schools and being a team physician is something that I've really always been interested in and I love to do. I love to be working with the kids, be on the sidelines at the games. I'm a big fan myself, and so I love going to the games and interacting and help take care of the kids as well. And that's something that was always important to Dr. Andrews in helping the community, but also helping his patients too.
When it comes to the procedures you describe, arthroscopic procedures using a camera, tell us how that is looking at the joint and giving you an assessment.
So it's almost kind of like playing a video game a little bit, and what we do is make small poke hole incisions around the joint, and then we use a special camera and special instruments to be able to minimally invasively access the joint and perform different procedures such as cleaning up a joint, doing repairs, reconstructions, all sorts of procedures to try and minimize the soft tissue damage to the joint and around the joint so that you can have a quicker and faster recovery.
When a patient comes to you with maybe an acute injury, tell us about your progression through treatment, where you start, and then, as you mentioned, maybe you end with surgery.
Sure. So the first and most important thing is getting the right diagnosis and working up the patient. So that especially means listening to the patient, and as a patient, you know your body best, and so what you're able to tell me is really the most important information that I can get. Also doing a thorough physical exam to make sure we don't miss anything. And then sometimes that requires imaging, such as x-rays or MRI. And then based off of that, we can work together as a team to determine what is the best treatment plan and treatment algorithm for you. That doesn't always include surgery, and a lot of times, and most things actually, we can treat without surgery. Most importantly with physical therapy and sometimes some immobilization, casts, splints like that. There are some cases where we do require surgery to get you better and get you back to being active and doing the things that you do and love.
When it comes to your practice, we know you have a passion for sports medicine. What are the other general orthopedic treatments or procedures that you do?
Yeah, so one big thing is fracture care, so any kind of acute or traumatic injury. That was something I had a lot of training during my residency program in Orlando. We were one of the busiest trauma centers in the country, and we had an extremely high caseload that was one of the busiest in the country as well. And so we had a lot of experience doing that. On the other end of the spectrum, kind of the end games, so to speak, for sports medicine is joint replacement, and that can be shoulder, hip, or knee. And that's often when arthritis sets in and the patient has a lot of pain, and getting them back to being active and, again, doing the things that they love. That can be very helpful.
Well, currently you and your family live in Milledgeville.
Correct.
And tell us about living and serving in that community. Tell us about your partner or how your office is set up there in Milledgeville.
Yeah, so we've loved living in Milledgeville so far. Everybody has been very nice and welcoming to us, and we appreciate all the culture and the values and all things that we share. Currently right now I am working with Dr. Hadaway with Ortho Georgia, who also sees patients from a non-operative side up in Milledgeville. And we work together as a team. He has a lot more experience, has been around for a long time, so we're able to work together as a team to come up with plans for patients and help treat patients to get them back.
Well, thanks so much for telling us so much about your practice.
Thank you so much. I appreciate you having me.
Thank you, and thank you for joining us at Navicent Knows Health. If you'd like to know more about Dr. Toth and his practice in Milledgeville, please visit us at navicenthealth.org.